Hi, this is Dr. Paul, and in this video we're going to discuss homocystinuria. It's important to talk about this genetic disorder because it looks a lot like Marfan syndrome, except for some key differences. One of the key differences being that in Marfan syndrome, the joints tend to be loose. They're very loose, and we call them lax joints, okay? Meaning they're very, very mobile. Okay, much more than the average person. The difference is in homocystinuria, what the joints look like are tight joints. Okay, so that's one of the key differences, even though it looks a lot like Marfan syndrome. So we still see things such as those long limbs. We still see things such as arachnodactyly. Okay. We also see curvature of the spine, like scoliosis, being very common amongst these people. Okay. Now the problem in homocystinuria is we're missing a key enzyme in the pathway where we take methionine and break it down into cysteine. The enzyme we're missing is called cystathionine beta synthase. And the fact that we're missing this enzyme means we can't take homocysteine and convert it into cystathionine. Okay. Now, what this looks like oftentimes is, aside from Marfan syndrome, is you'll see children who have some very odd problems. Okay. Usually clotting type disorders. So look out for a young child who has evidence of DVTs, a young patient who has a myocardial infarction, or a young patient who has a stroke. Okay, looking for any young patient less than 10 years of age who dies from a massive stroke or some other odd vascular or cardiovascular finding for their age. Okay, thromboembolic events that involve large or small vessels. Okay, should point you to homocystinuria. Okay, the reason why is because elevated levels of homocysteine are associated with higher risks of stroke. Okay. One of the other key findings associated with homocystinuria is that we get retinal detachment. Now this is different from the retinal detachment seen in Marfan syndrome, okay? Because what happens is they get retinal detachment from the top. Whereas in Marfan syndrome, they get retinal detachment from the bottom. So that's a very key difference when they're trying to confuse you about Marfan's versus homocystinuria. Now let's draw out the pathway so you can see exactly what's going on and where the exact enzyme is missing within the pathway. So as I mentioned, we're going to start out with methionine. And methionine is going to be converted to both succinyl-CoA and the important product for our pathway, which is S-adenosyl methionine. And S-adenosyl methionine, don't forget, is SAM. And SAM is a methyl donor involved in many reactions throughout biochemistry. Then from here, we're going to create S-adenosyl homocysteine. Then S-adenosyl homocysteine is going to be broken down into two products. We're going to make adenosine and we're going to make homocysteine. Now, normally, homocysteine is going to be converted to cystathione with the enzyme cystathione synthase. And cystathione then becomes cysteine with the help of the enzyme cystathionase. Now, the problem in homocystinuria is that we're missing the enzyme cystathione B synthase. Okay? Now, something to keep in mind is that cofactors involved in this reaction are serine as well as vitamin B6. But it's not important because in homocystinuria, this enzyme is missing. Therefore, we can't make cysteine. Okay? And cysteine is an amino acid. And when we can't make it, it then becomes an essential amino acid. Okay, so it has to be taken in through the diet. Now, something important to keep in mind when it comes to homocystinuria. Now, there's no actual treatment that's 100% effective, but giving massive doses of vitamin B6, which is also known as pyridoxine, has actually been shown to improve patients who have homocystinuria. Now, this is going to be effective approximately 50% of the time. But I've seen a question on the USMLE about this. They'll ask about B6 and its role in helping to manage homocystinuria. So while it's not a 100% perfect treatment, this has been shown to improve symptoms, and it's one of the only ways we know to improve symptoms in a patient with homocystinuria.